Do you feel like you got your shit together and you're trying to help yourself? You're trying to help this injury and you've gotten better, but you still feel like there's the piece of the puzzle missing. We're going to talk about what that might be today.
The goal here is to learn how to treat your mind and body like a professional athlete. Welcome to Mind Your Body. I'm Dr. Audra Lance. I'm a doctor of chiropractic who specializes in treating sports and non-surgical injuries, anything that involves muscles and joints. I treat big-name celebrities and professional athletes. Most of my patients refer to me as the witch doctor because they can't explain any other way their pain was removed that quickly. I hate cooking, but I do love wine and don't even think about giving me anything that involves ketchup because I will not eat it. Every episode of this show is designed to help you move better, live better, and feel better. Now let's go do this thing.
Well, I get it. You finally convinced yourself to take some baby steps or maybe a big leap off the rock and help yourself and fix your chronic pain, your injury, something you've been dealing with for a while, increase your performance, whatever it may be. You got the gumption, talked yourself into it. You're doing a few things and you've made progress, but you're stuck. Frustrating and you want to quit. Ugh, please don't. We're going to do a series talking about this, and I'm just going to go through things that might be hindering your progress that you can just add to the puzzle piece and see if they work. And maybe that's your missing piece. But kind of like the embarrassing health questions, this is just going to be sprinkled through the podcast. So keep binging. So many fun things to come. This is also something that is not talked about a lot that can make a huge difference in recovering from an injury. Have you guessed it yet? Scar tissue. Do you have a scar anywhere in your body? Take a second and think. Did you fall as a kid? Did you have any surgery? Did you cut yourself open accidentally with a knife cooking like I probably did? That can all cause pain. It can cause decreased perception, so you might not even be able to feel it. What else causes scars? So if you've had a child and you had any kind of tear or rip, if you had an episiotomy, if you've had a LEEP procedure, if you've had any abdominal surgery, even laparoscopic, the scars are small. Cesarean section, breast augmentation, facelift, any kind of surgery, including eye surgery, you have scars. Some of our scars are more internal, like birth or LEEP. Others you can see. Even if you've fallen and scraped your arm and cut it open, or any kind of bite, there is scar tissue there and it needs to be addressed. And you may not feel like it's related to your injury, but we work on this and magic happens. It's pretty cool. So what is scar tissue? Scar tissue is when your tissue heals with this fibrous connective tissue. And what that means is it's not as fully innervated as your normal skin tissue and fascia. It's kind of like almost a dead zone to your brain. So this just causes a little disruption in your brain map of your body and how it functions. Kind of like people talk about if someone loses a foot or phantom limb pain. Some of the same principles on a lesser level. I don't know if that's correct English. But that's not what you're here for, and that's not why you listen. So what do you need to do? Well, we need to work on that tissue and address it. So first, think if you have any scars. And I don't even care what your chronic problem is right now. You still need to address it. It always needs to be addressed. I don't care if it's 30 years later. We need to work on it. So let's go. Look at your scar. What's the coloring of it? What's the shape of it? What's it feel like? Can you feel it? Is there pain when you touch it? Can you not feel anything at all when you touch it? Do you have When you do touch it, do some feelings arise, such as you want to bawl? Is it linked to a traumatic event? These are all normal. Well, they're not normal, but these are experiences that you may feel with the scar tissue. These are all normal experiences that indicate that you do have a scar and it's there. So all different levels. So if this is causing an emotional reaction, we want to address that, and that's okay. So if you're going to do some scar work in an ideal situation, I would have you do a couple minutes of belly breathing. And yes, that includes breathing in your butthole. But sit there, it's calming down. Inhale through your nose, exhale through your nose. And after you do a couple belly breaths, think about breathing wherever that scar is. It could all be all the way out at your foot, just a couple breaths. And then I want you to look at the scar, whichever direction it's going. You're going to go perpendicular to that. So you're not going to rub in the direction of the scar. It's going to be in the opposite. So if your scar is vertical, you're going to cross friction, we call it horizontal. So you can use some vitamin E oil, emu oil, whatever to put on it, or some lotion to make it a little more tolerable, especially if this is your first time working on it. And you just want to lightly go over that scar with small little strokes. You can use 2 fingers. Some people have gua sha tools. I even tell people you can use a butter knife, not the end you would spread the butter with, but the end that you hold. Once again, I'm not telling you to use a sharp knife on yourself, just that blunt, soft end. You can just lightly, and start super light, and only start with 30 seconds. We're going to dose this super light, and you're going to work your way up and add 5 to 10 seconds each time. Super simple. That alone can make a huge difference in your scar tissue. Yes, if you're seeing us at the office or getting treatment, we're going to go a little bit deeper and do a little bit more intensive. But this is something that you can do at home that you will notice a change. So what are the changes we're talking about? You may notice a color and change, color and sensation, more mobility to that area, meaning you can move the scar tissue around better, which is huge, meaning you're breaking up the scar tissue. We're starting to get a little blood flow to that area. And that's just, in turn, going to help so many things in your body, including your connective tissue. And it may be that missing puzzle piece to your pain. Let me tell you an example. But to interrupt that, if you need something to make you feel better and move this connective tissue around, breathe in this connective tissue, be in the moment, you really need to go get Destress for $20. It's only $39 right now, which is an insane price. I can't believe I'm even offering it for that. But I just want you to have access to this and be able to do this yourself. So you're going to combine some movements, and you can just go in the movements and breathe. So your scars might be in some of these places, such as your pelvic floor, and you just hold them with me, listen to me sing, listen to me banter, laugh, and we have fun together. And you just breathe. And then I give you progressions of other things you can do in those movements. So you can just use this as a mobility flow, or you can make it a workout, whatever you need. But your mind's going to relax. You're going to be in the moment. You're going to be focused, and you're going to be helping yourself some of these internal scars too. So back to my example. I had a lady who had this chronic back pain, and we got it 90% better. And we're like, I'm not satisfied with that. So kept looking. Well, we worked on her C-section scar, which was beautifully done. It was incredible. It wasn't terrible. And there was not even any real trauma associated with it. And in 3 sessions, that last 10% was resolved. Incredible, right? So this may be you. This could be, I've worked with a couple athletes that have had foot surgery. So whether for bunions, broken feet, you name the gamut. And scar tissue is one of the first things that we hit. And immediately when we go to their, I guess you would call it rehab exercises, their foot activations, this changes the pattern in their brain and they're able to access the muscles I'm trying to get them to access. Brilliant, right? So I'm dying to hear if you've tried this. Please DM me at Dr. Audra Lance on Instagram and stay tuned for more little puzzle pieces.
Now, if you want to do something really special for me and got a lot out of this episode, go leave a 5-star written review of the show on Apple Podcast. And if you're a Spotify listener, just tap the 5 stars. To submit any of your health questions to the show, simply DM me on Instagram at Dr. Audra Lance. And don't worry, all your questions will be kept strictly anonymous. So send me all your embarrassing questions. And don't forget, breathe into your butthole. Toodaloo!